New Mexico's hospitals are seeing more patients in intensive care units, but they're not all from coronavirus patients. News 13's Gabrielle Burkhart spoke with health officials about what they're noticing as people make their way back to their doctor.
Yeah, when the state planned for a surge in coronavirus cases, the medical advisory team made sure hospitals were prepared with more ICU beds than normal. Now, data shows a lot of those beds are being used by patients who don't have the virus.
And so now, as a result of I think people being concerned about coming to the healthcare system, they delayed care and now are coming in with complications from not seeing their diabetes specialist or not following up with their cardiologist.
Dr. David Scrace, Secretary of the Human Services Department, says when the pandemic hit, the state's medical advisory team went to work doubling the normal amount of ICU beds in the state's 7 hub hospitals and created a model for transferring patients in need of critical care.
Together we were able to do that. If we would have stayed as individual hospitals, that could not have happened as well as it did.
For example, the University of New Mexico's pediatric surgery operating room is now an ICU. On the state's website, you can see the normal number of ICU beds is 230. And since June 1st, we've been above that with 286 ICU beds in use statewide. But staff says it isn't all due to COVID-19 or hospitals delaying elective procedures.
You have a real pileup, I guess, of patients who have just put things off and who had that ache or that pain and didn't go into the doctor because they were scared.
Hospitals are also seeing more trauma patients come in earlier in the season than usual.
These are motorcycle accidents, car accidents. It could be falls, people up cleaning their roof off or cleaning out their gutters right now. Once the weather got nice and people just wanted to be outside. So we're seeing more injuries that are pretty severe.
Since more people are making appointments again, there are some delays, but doctors are encouraging everyone to seek care if needed.
Everybody automatically thinks of a hospital or a doctor's office as where you're going to catch it. And actually, we're safer than going to a grocery store or going out to shopping for something else because we're masking, we're gloving, we're doing good hand hygiene.
Now, hospital capacity is, of course, something the state's medical team is paying close attention to. If New Mexico sees more than 460 patients in ICU beds, that's when crisis standards of care are invoked. The state's maximum capacity for ICU beds is 614. Back to you.
Okay, Gabrielle. Albuquerque has also been getting patients from the northwest part of the state where they have smaller ICUs.